Good afternoon. I'd like to welcome you this afternoon to our media availability regarding our first confirmed cases of Omicron in North Dakota. We appreciate you taking time out of your busy days to share time with us and to have help us get the information out to the public regarding these first cases. On December 19th, the North Dakota Department of Health Laboratory confirmed 4 cases of Omicron variant in North Dakota, and all of these cases occurred in adults. All of the cases had symptoms. None of the cases were hospitalized. 3 of the 4 cases were vaccinated with 2 doses of COVID-19 vaccine, but were not boosted. None of the cases were reinfections. 2 of the cases did have a history of travel. They traveled together domestically, and 2 cases had no travel history and were not related to each other, indicating that we have community transmission that had occurred in North Dakota. In addition, these 2 cases were not geographically similar, so indicating that we have transmission that's occurring in 2 different geographic areas of North Dakota. So Omicron, I think, is what's important is that Omicron may be spreading in other areas of the state as well. It's not just in the areas where we happen to confirm these first cases. As you know, we don't routinely whole genome sequence every positive test, and it's only a sample of tests, positive tests that get sequenced. And so our sensitivity is not 100% for detecting Omicron in North Dakota or other variants. So a little bit of background about the Omicron variant. It was first identified in Southern Africa in late November. It has spread rapidly throughout the world in the United States, and in North Dakota is the 46th state now to report this variant. At least it was as of early this afternoon. Omicron has multiple mutations on the spike protein that are concerning, and I think that's really the highlight of this, is that this particular variant has so many different mutations that have occurred on its spike protein compared to other variants that have emerged earlier. You know, I think there's a lot of questions regarding Omicron, and some of it is regarding vaccine effectiveness and whether prior infection will offer protection. How infectious is it compared to other COVID viruses that are circulating? Whether monoclonal antibody therapy will continue to work, and how serious is the disease compared to other variants. And so I'm going to run through a little bit of what's emerging. Just a reminder, we have so much to learn about this variant. It is still relatively new, and we are still learning a lot. Much of what we are learning is coming out of South Africa and out of Europe, but we are starting to learn a little bit more about what's happening here in the United States as well. So just to talk a little bit about vaccine effectiveness, the data that's really emerging is showing that with Omicron, the bottom line really is that booster doses are a necessary part of providing optimal protection against Omicron. 2 doses of vaccine don't provide optimal protection. And early data is showing that the 2 doses of vaccine provide only reduced levels of protection against symptomatic disease, with vaccine effectiveness coming in right around 30 to 40% with just 2 doses. I think that the sliver of good news here is that with the booster dose, this raises vaccine effectiveness back up to that 70 to 80% range against symptomatic infection, and it's likely higher for preventing hospitalizations and other severe illness due to COVID-19. Vaccines are expected to offer protection against severe illness, hospitalizations, and deaths for both Delta and Omicron variants. And so I think it's important to remember that that these vaccines do work, but that we need to have the data is showing that the booster doses provide that optimal protection. We get a lot of questions regarding prior infection and whether prior infection provides immunity. And prior infection does provide immunity, but what is coming out of South Africa is that prior infection with previous variant viruses did not appear to offer the protection against Omicron that it would against the other previous variants. And in laboratory studies, a vaccine booster post-infection does increase antibody activity against Omicron. For those individuals who have had disease and they do get a vaccine dose, that vaccine dose does help bring those antibody activities back up. And this is in vitro studies, again, in laboratory-based studies. And so I think we have more to learn about this in the real world, but I think the early indication is that even for those who have previous infections, that vaccine doses after infection are going to be important. In terms of infectiousness, what has emerged is that this virus transmits very rapidly within the population. Estimates are around a doubling time, of cases doubling about every 3 days. There's an increased reproduction in the bronchial tissue of about 70 times the rate of Delta. So when they did some laboratory-based studies looking at how Omicron will behave in bronchial cells, it reproduced very rapidly in those cells, and that could lead to more infections. Then in South Africa, the risk of reinfection with Omicron was almost 2.4 times higher than what it was seen with Beta or Delta variants. Beta is a variant that we didn't see a whole lot of in North Dakota, but it actually emerged in Southern Africa, and so they did have a Beta wave. And when they look at how Omicron reinfections with Omicron occurred in individuals, it was almost, like I said, 2.4 times higher than with Beta or Delta. So reinfections do occur. The risk is greater for Omicron, and that any immunity that you have from previous infections is probably going to be incomplete. Monoclonal antibody therapy is another important part of what we need to talk about. As you know, monoclonal antibody therapy is recommended for individuals who may be at high risk for a severe outcome. They've been diagnosed with COVID-19 and they're not sick enough to be hospitalized. Monoclonal antibody therapy has shown to help reduce the risk for these severe outcomes and to keep people out of the hospital. What early studies are showing is that at least 2 of the 3 that are widely used in the United States, therapies that are widely used in the United States, are showing to be having a reduced ability to be effective against the Omicron variant. So I think with monoclonal antibody therapies, we're seeing some information emerging now where 2 of the 3 therapies may not be as good as what we want them to be, and that puts a lot of pressure with the just one remaining therapy, and so it's important that individuals can do what they can to prevent disease instead of being treated for disease. So there is one particular monoclonal antibody therapy that is showing to have higher levels of activity against Omicron, and that's the good news. In terms of testing, diagnostic testing, both the antigen testing and the amplified testing, such as PCR, that we have in the United States, continue to detect Omicron. So this is good. So there isn't a loss of diagnostic ability for detecting Omicron. And testing remains an important component of reducing the spread of COVID-19. And so we encourage testing, and we are also encouraging people to think about various ways that they can get tested. You know, obviously, if they're symptomatic, they can seek testing with their healthcare provider. They can go into a public testing site, but also think about the testing that's available at home. There are self-tests that are available that people can take home, and they can do their own testing. And I think the important part about that is that if you do test positive at home, to take the proper precautions, making sure that you are isolating yourself from others and protecting others from infection. So testing often, testing when you're symptomatic, and testing when you're identified as a close contact. If you have a friend or a relative that's been diagnosed and you get notified by them that you're a close contact, we recommend that you test test right away after you find out, and then test 5 to 7 days in, or as soon as you develop symptoms, go in and get tested. And so that testing is going to be important. We recommend self-quarantining yet for those individuals who are contacts to COVID-19. In terms of disease seriousness with Omicron, it's too early to know for sure, but among adults in South Africa, hospitalization rates are lower compared to the Delta and the Beta waves. But we also know that hospitalizations tend to be a lagging indicator. And so I think we have to wait to see exactly what happens with that in the end. I think it's too early to tell. But also out of South Africa, they are reporting among younger children that hospitalization rates are tending to go up a little bit. And again, we still don't have all of the context around that. But we have to think, I think we have to just watch this carefully to see how this emerges. I don't think we have a real good understanding of what the seriousness of this particular variant is. In terms of prevention, I think it's really important to understand that all of the things that we've been talking about the last almost 2 years now are still important. We've added vaccinations. We just recently celebrated the 1-year anniversary of starting vaccinations in North Dakota. And vaccination is a very important component. In fact, it remains our best tool to prevent serious disease, hospitalizations, and death. But in addition to vaccination, other things that really are important are, staying home when you're ill, testing for COVID-19 if you develop symptoms, and also thinking about influenza. We now have influenza season upon us. We do have influenza circulating in North Dakota, both influenza A and influenza B. And the symptoms for influenza and COVID overlap quite a bit. And so, if people who are symptomatic should be really considering getting tested for both influenza and COVID-19. If you're diagnosed with COVID-19, self-isolating for those 10 days. If you're exposed, testing twice right after you've been notified of an exposure, and then again 5 to 7 days after exposure, and then that self-quarantine for that 7-day period. If you test negative after 7 days and are asymptomatic, you can release yourself from quarantine. Avoiding large crowds and poorly ventilated indoor spaces is still important. Social distancing is still important. Wearing a mask when indoors and in public places is important. And then good hand hygiene, washing your hands, along with good respiratory etiquette still remain important. We're approaching the Christmas holiday, and I think that a lot of people have questions. Well, how does Omicron fit into their Christmas holiday plans? And it's not a welcome guest, and that's the bottom line. But it's here in North Dakota, and we know it's here. And I think that from our perspective, as we approach the holidays, again, urging vaccination and boosters, being vaccinated against both COVID-19 and influenza. Get boosted. If you haven't had a booster dose yet and you're due for a booster dose, it's been 6 months since your last dose of mRNA vaccine, or it's been 2 months since your last dose of Johnson & Johnson vaccine, go ahead and get boosted. And also, if you're 16 and older, get boosted. It's approved now for 16 and older. And if you're 5 and older, you haven't started your vaccination series, we hope that you would choose to start your vaccination series now. Stay home from, if you're ill, don't risk infecting family members. Get tested if you are ill. Consider testing if not symptomatic before getting together. So as you move forward into the holidays and you get together, think about the various options. You may want to go and get a rapid antigen test before you get together with family members, just to make sure you're negative before you go to your gatherings. Or you may want to buy an at-home test and check yourself. But we think that this is really a good idea. Understanding your status before you go and visit relatives, especially if you're getting together with relatives that may be at higher risk for severe outcomes. And then again, just considering those at higher risk for in the role of masking and social distancing to help protect those individuals at higher risk as well. As we move into the holidays, this is really just, I think this is just so important that the smaller the gatherings, the better. It reduces the risk. If you have a smaller cohort, it reduces the risk of having large outbreaks. I know that it's not always possible, and I think we at the health department understand that as the holidays come, people are wanting to get together with family and friends. But think about creative ways that you can reduce risk for each other, whether it's testing before you go, getting those booster doses in if you can, and if you can limit your gathering size, that helps as well. So, but those are the things that I have today. I'm certainly open to questions at this point in time. So the question, we have one question here from KVRR, Mr. Austin Erickson. He asked, North Dakota is 42nd in the nation for percentage of population fully vaccinated and 52% based on this. Do you believe Omicron has a high possibility or probability of spreading in the state? I think Omicron has demonstrated that it is a very infectious virus. When we look at what happened just looking at what's happening in Europe and South Africa, how rapidly those cases increased. When you look at what happened in Cornell University, that little college, they had 900 cases reported in just a 1-week period. I think the idea is that to protect against symptomatic disease, to get some semblance of protection against symptomatic disease, people need to have a booster just to get to that sort of that 75% range of vaccine effectiveness. You need to have the booster to have that level of protection against Omicron. We're not there yet in North Dakota. We're just getting started with our vaccination doses. We have more work to do there. So yes, I think there is potential for rapid spread in North Dakota with Omicron. So from Michelle Griffith at the forum, since the state is using genome sequencing to give a snapshot of the prevalence of variants in the state, what can we infer about how widespread Omicron is in North Dakota by the fact that there are 4 Omicron variant cases? I don't know if I can give a good estimate on this. I know that our variant surveillance isn't, that sensitivity isn't 100%. We are able to sequence maybe 5 to 10%, depending on the week, maybe up to 15% of the positives that come through our laboratory. When you start looking at all of the antigen testing that's occurring in the state, right now antigen testing is close to about half of all the testing in the state. Those individuals who test positive by antigen don't have an opportunity to have that specimen whole genome sequenced. Those specimens aren't eligible for whole genome sequencing. And so it's only those that test positive by a PCR that get submitted to our lab that have that opportunity. And so when we talk about the 4 that we're reporting today, we know that that's not the whole story in North Dakota, and that there's certainly more Omicron circulating in our state than what the 4 we have detected so far. So the next question from Chris Berg is, how does the antigen and PCR test detect Omicron? Can you walk us through the process? And so the process for whole genome sequencing, PCR testing and antigen testing are diagnostic tests. They cannot differentiate between the different variants. So when you go in and have an antigen test or a PCR test, that's just telling you have the COVID, the SARS-CoV-2 virus in your system. And so in order to understand what variant that may be, if you test positive on an amplified test such as PCR, then that sample can be submitted for whole genome sequencing. And once it goes through whole genome sequencing, that sequence, that data that is generated out of that RNA sequence, then gets analyzed and compared to known sequences, and that's how the variant is assigned. So the specimen that is PCR positive, it goes through whole genome sequencing. That sequence is compared to known sequences, and then it gets assigned a variant, whether it's, and generally it's assigned a lineage. So for example, if it's alpha, it's B117. And so that's how the process works. The antigen test and the PCR test in and of itself cannot identify a particular variant. It just tells you that the SARS-CoV virus is present. Do you anticipate a peak to come and go quickly? I think that this is from Danielle Webster, and I think that's a very good question. And I've been watching to see what's happening, like in South Africa. I think there's some indication that they may have peaked, but I think it's too early for me to tell. Maybe my glass is always half empty on these types of things. But from my perspective, they had a very rapid increase. When you look at Denmark, they had rapid increases. What's happening in Europe, and those countries are very rapid increases. We're starting to see some of that in New Jersey and New York City right now. And so I think that that's a possibility. Our Delta wave, we had this peak that occurred back in September, and we've been coming down very, very slowly from that. We really sort of plateaued with Delta. When we went into our peak last November, we had a pretty rapid rise in fall in cases back in November. So I think that's a possibility with this, that we could see a rapid rise and fall, but it's too early for me to tell. So, all right. Are there any other questions? And I do have Jenny Galbraith with me with our she's with our vaccine program. She's our COVID vaccine program manager. If you have any specific vaccine related questions, she's available as well. Okay, I do see one more question here. So this is from Chris Larson with Flag Family Media. With the Christmas holiday this week, is any guidance changing from the Department of Health regarding gathering for the holidays? I think our guidance has been fairly consistent all along. The idea that what we want to do is try to introduce ideas for individuals to make decisions how to decrease the risk for COVID-19 and to decrease the risk of transmission. And those ideas can be layered. These mitigations can be layered. Obviously we are recommending vaccination. We are encouraging people to choose to be vaccinated. And then the other part of this is minimizing your gathering size will help reduce the risk. If you don't have a large cohort getting together, and somebody does happen to be infectious while you're getting together, it reduces the number of people that may be exposed. I think that the social distancing and the masking and ventilating as much as possible, those are options as well. They may not be, again, families have to decide what's going to work best for them. But just know that there is a risk with getting together when you're gathering, and that risk isn't zero. And that, with this particular virus, we know that there can be severe outcomes, and some people can have severe outcomes with this, and that's what we're trying to avoid. So. All right, are there any other questions? If not, I appreciate, again, you taking time to be with us today and helping us get this information out. We do appreciate your time and thank you, and we hope that you all have a very safe and happy Christmas. Thank you.